Tell me honestly, when was the last time you looked at a board, a street sign or a TV screen and didn't squint? If you have to think about it, then this conversation is probably for you. Myopia is one of the most common vision problems in the world. According to the World Health Organization, by 2050, almost half of the world's population will suffer from it. Half. This is not a rare diagnosis, and it is not a disease of the elderly. It is the reality for millions of people: school children, students, office workers, young parents. And yet, many of them live with myopia for years without understanding what is happening to their eyes. They simply got used to squinting. They simply think that everyone is like this. They simply bought glasses, and that was the end of it. Today, we will figure out what myopia really is, why it develops, what can be done about it, and most importantly, what definitely should not be done.
What is myopia in simple words? The eye works like a camera. When you look at an object, light rays pass through the cornea and the lens, are refracted and focused on the retina, a thin light-sensitive membrane on the back wall of the eye. That is where the image is formed, and then it is sent to the brain. With normal vision, the focus lands exactly on the retina. With myopia, it falls slightly in front of it, literally a fraction of a millimeter too early. And that is enough for the image to become blurred.
Why does the focus shift forward? Most often because the eye is a little longer than it should be. Instead of being almost perfectly round, it stretches in length, like an egg instead of a ball. Because of this, distant objects look unclear, while close objects remain fairly visible. That is where the name comes from: nearsightedness. Up close, you can see; far away, you cannot.
It is measured in diopters.
If you have -1, that is mild myopia, and distant objects are just a little blurry. -3, it is already much harder without glasses. -6 and above, this is a high degree, in which a person can hardly navigate in space without correction.
How it feels in real life.
The symptoms of myopia usually appear gradually, and at first they are easy to miss or blame on fatigue. The first sign is blurred distance vision. You notice that street signs have become unclear. Subtitles in the cinema used to be readable from any row, but now only if you sit close to the screen. You can only see the bus number when it is already almost next to you.
The second sign is squinting.
This is an instinctive reaction. When we squint, we reduce the diameter of the optical opening and for a moment get a sharper image. It works, but only as a temporary trick. If you notice that you constantly squint when looking into the distance, that is already a signal. The third sign is headaches and eye fatigue. When a person with myopia tries to focus on distant objects without correction, the eyes work with extra strain. This causes fatigue, heaviness in the eyes by evening, and sometimes a mild headache, especially after driving or prolonged computer work. In children, myopia often shows up differently. The child starts sitting closer to the TV, complains that they can't see the board well, and does worse at school, simply because they cannot see what is written. Parents do not always immediately connect these things to vision.
Why it develops?
Myopia is the result of the interaction between genetics and lifestyle. With genetics, everything is quite straightforward. If both parents are nearsighted, the risk that the child will also become nearsighted is significantly higher. If only one parent is nearsighted, the risk is lower, but it is still there. The eye inherits a certain shape and a tendency to elongate. But genes are not a verdict. A huge role is played by how a person lives and how their eyes work every day. The main risk factor is prolonged near work without breaks. When the eye focuses on a close object for a long time, a book, a screen, a phone, the eye muscles remain under constant tension. Over time, the eye adapts to this mode, and one of the theories explains the progression of myopia precisely by this adaptation. The eye sort of decides that seeing up close is more important and restructures itself for this task. The second important factor is not spending enough time outdoors. Several major studies have shown that children who spend at least 2 hours a day outside are less likely to develop myopia and less likely to experience its progression. The reason is probably that outdoors the eye looks into the distance and sunlight affects the production of certain substances in the retina that slow down the growth of the eye. That is why myopia has become so much younger over the past decades. Children sit in front of screens for several hours a day from an early age. They almost never play outside. The perfect conditions for the development of myopia. Common misconceptions. There are several persistent myths surrounding myopia that prevent people from properly understanding their condition. The first and most popular: if you wear glasses all the time, your vision will deteriorate faster. This is not true. Glasses do not accelerate the progression of myopia. They simply allow the eye to see clearly. Refusing glasses makes the eyes strain more, but it does not stop the pathological process. The second myth: myopia can be cured with eye exercises. Eye exercises are a good habit that helps relieve muscle tension and fatigue, but they do not change the shape of the eyeball and do not restore lost diopters. Myopia does not go away from exercises. The third myth: surgery is scary and dangerous. Today, laser vision correction is one of the most refined and safest surgical procedures in the world. Millions of people have undergone it. But surgery is not a universal solution for everyone. There are age limits, indications, and contraindications that a doctor evaluates individually. The fourth myth, especially relevant for parents: let's wait, it will go away on its own. Myopia does not go away by itself. In children, it most often progresses until the age of 18 to 20, while the eye is still growing. The earlier monitoring and, if necessary, treatment begin, the lower the risk of reaching high degrees. Degrees and what stands behind them. Myopia is usually divided into 3 degrees: mild, up to 3 diopters; moderate, from 3 to 6; high, 6 and above. This division is important not only for choosing glasses. In high myopia, the eye is stretched much more strongly, and this creates mechanical tension inside. The retina stretches together with the eyeball. The risk of thinning, tears, and, in rare but serious cases, retinal detachment increases. Therefore, people with high myopia should regularly undergo a fundus examination, not because it is some obligatory ritual, but because early retinal changes are treated quickly and easily, while advanced ones are a completely different story. How myopia is corrected. Glasses are the simplest and most accessible method. They do not treat the condition, but they make it possible to see clearly. The lenses diverge the light rays so that the focus shifts backward to where it should be. Contact lenses work on the same principle, only they sit directly on the cornea. For many people, this is more convenient. There is no frame, no limitation in sports, and peripheral vision is better. But contact lenses require hygiene and discipline, otherwise there is a risk of infection. Orthokeratology is the use of night lenses worn before sleep. Overnight, they gently change the shape of the cornea, and in the morning the person removes them and sees without glasses for several hours. This is not a permanent change. By evening, the cornea returns to its original shape. The method is especially popular for children and teenagers. There is evidence that it slows the progression of myopia. Laser correction, LASIK, femtoLASIK, Smile Pro, is already a permanent change in the shape of the cornea using a laser. The surgery removes the diopters, and afterwards the person sees without glasses. It is suitable for people aged 18 to 20 and older, with stable myopia and sufficient corneal thickness. More details about these methods are in separate videos on our channel. With high myopia, when laser correction is not possible, implantation of phakic lenses, ICL, is used. That is also a separate big topic.
When to go to the doctor? The answer is simple.
If you have started seeing worse in the distance, it is already time. There is no need to wait until it gets really bad. Children are recommended to have their vision checked for the first time at age 3, then before school, and then annually. If there is myopia in the family, all the more reason not to delay. Adults with already diagnosed myopia, once a year, to monitor the dynamics and the condition of the retina.
Seek immediate medical attention from an ophthalmologist if flashes appear before your eyes, floating dark spots, or a curtain in the field of vision. This may be a sign of retinal problems that require urgent attention.
Myopia is not just an inconvenience. It is a condition that needs to be monitored, properly corrected, and, if necessary, treated. If you have not seen an ophthalmologist for a long time, if you feel that your vision has changed, or if you want to understand whether you have options to get rid of glasses, come for an examination at the Ko'z Nuri Clinic. We will conduct a full diagnostic evaluation, check not only visual acuity but also the condition of the retina, the pressure inside the eye, and answer all your questions. Contact details are in the description under the video.